give birth. WHO further reveals that a woman's lifetime risk of maternal death is the probability that a 15-year-old woman will eventually die from a maternal cause. So how do we avoid maternal deaths? Joining me in this studio is Dr. Angela Nzeze, who is a consultant, obstetrician, and also a gynecologist. Karibu sana.
Thank you very much.
Is this your first time in TV47?
Yes.
Hopefully the environment is good?
Yeah, I love it. It's a lovely place.
Briefly,
Yeah.
what is postpartum hemorrhage? In short, I mean, people from your field will normally say PPH.
You also forgot to mention that I'm a member of the Kenya Obstetric and Ecological Society.
Is there any other hat that I forgot?
I'm a consultant gynecologist based at Kenyatta National Hospital and private practice at Prof. Nelson Awori Center.
Wow, okay. So now what, in layman's term, what is PPH?
So PPH in full is actually postpartum hemorrhage. And postpartum hemorrhage is actually heavy bleeding that occurs after childbirth. And if you look at a 500 ml soda bottle, so that's the estimated amount in vaginal delivery, after vaginal delivery.
Okay.
So anything that's more than 500 ml after vaginal delivery is considered postpartum hemorrhage.
Right.
If you look at a cesarean section, bleeding that's more than 1,000 mLs is considered postpartum hemorrhage.
Okay.
Yes.
Dr. Before we actually continue, I want us to take a look at this particular story in Malindi, where medical practitioners at the Malindi Sub-County Hospital in Kilifi County have come up with an innovation that will help reduce postpartum hemorrhage among women. This condition causes a woman to lose more than 500 milliliters of blood and is the leading cause of maternal deaths and morbidity in the world. Our reporter Elizabeth Atieno now reports on this new innovation dubbed E-Motive that seeks to reduce deaths emanating from postpartum hemorrhage by, get this, 60%.
At the Malindi Sub-County Hospital, we head straight to the maternity and labor ward. Hundreds of expectant women are in the waiting area. This is a high-volume medical facility that serves 3 counties, including Kilifi, Tana River, and Lamu, and it is estimated that between 80 and 100 women give birth in the facility every week. Unfortunately, 6% develop postpartum hemorrhage, which occurs when a woman experiences heavy bleeding within 24 hours after giving birth. In a bid to curb this menace, the hospital has come up with a reusable graduated drip made of plastic bags or Macintosh and a blood collecting container placed under the bed. This is aimed at preventing postpartum hemorrhage, which accounts for 34% of 5,000 maternal deaths reported annually in Kenya.
This treatment, which is using the drape to accurately diagnose postpartum hemorrhage and then using the bundle of treatment, reduce the number of women who bleed a liter or more of blood by an incredible 60%. So huge effect was seen.
The innovative drip is spread on the bed and the patient sleeps on it. It has strings that are tied around the patient's waist to avoid it slipping out when there is bleeding. The blood then flows down to the bowl, marked in milliliters. The milliliters range from 100 to 500 milliliters, and when the blood surpasses the 300 milliliter mark, then medication is administered to the patient.
So initially we'd have to struggle with trying to look for blood to transfuse these women. Some needed who had developed acute renal issues had to be dialyzed, and some needed ICU care, and some were lost. So now we've seen a reduction in that. We are transfusing less mothers because now we can quickly manage postpartum hemorrhage in good time. We are not having a lot of morbidity from surgeries that we used to do for these mothers, and we are having less women being dialyzed. And we are also grateful for the fact that we have the quality drugs that we need to use to manage these patients in terms of oxytocin and tranexamic acid. So those are some of the things which we would like to have a continuous supply of from the Ministry of Health, KEMSA, the counties, so that we can always manage postpartum hemorrhage in a way that there is continuity and we stop discussing it as one of the major killers of women in our area.
A woman has lost too much blood. On that accurate measurement, then we give a bundle of treatment called Motive, and that has got drugs in it like oxytocin, like tranexamic acid, but also other steps which would improve the outcome for the patient.
Dr. Maureen Were, who is a lead gynecologist at the Malindi Sub-County Hospital, led a team of nurses to develop the gadget after a one-year pilot project conducted using the e-Motive technology, which involves over 200,000 women in 4 African countries, including Kenya, Nigeria, Tanzania, and South Africa.
So the uptake has been really good. We've gotten good reception for the patients. And the other thing is that it's clean. There's no blood going everywhere. So the mother feels like she's clean. The blood is not soaking around her.
We were leading the activities of this trial from the University of Nairobi hub, and we had several facilities participating, a total of 19. And then the last part of the trial, we had 7 facilities that were carrying out the intervention.
During the pilot study, a non-reusable graduated drip was provided by the Bill and Melinda Gates Foundation at a cost of $2. Hence, the Malindi Sub-County Hospital opted to innovate one that is reusable.
It has come down in cost already to about $1.5.
Kina mama takriban 6,000 wamepata kupitia hii initiative, na wale wamama wamefaidika kwa sababu outcome imekuwa ni nzuri. Matokeo yamekuwa ni mazuri.
A call has been made to the Ministry of Health to provide the e-Motive technology to various health facilities across the country so as to prevent postpartum hemorrhage.
We are really looking forward now to have the findings of this study being translated into guidelines, starting from the World Health Organization, coming down to countries and Ministry of Health. And there's also a component of quality of medicines, which we hope to take up again with the Ministry of Health, Pharmacy and Poisons Board and KEMSA, so that we have drugs that are going to be of quality.
Statistics from the World Health Organization indicate that 14 million women across the globe experience postpartum hemorrhage and that 70,000 women die due to excessive bleeding every year. Elizabeth Atieno, TV 47.
Thank you for that, Elizabeth Atieno. It basically forms the basis of our conversation here, Daktari. And I'm curious, that is in Malindi Sub-County. What now, situation ikoaje kwa ground in other parts of the country? Do we see such kind of innovations in other parts of the country as well?
Well, I cannot say that it's uniform, unfortunately. Not all the counties are well equipped. Okay. Some counties, some hospitals may not have enough facilities to manage PPH. Okay. They may not have enough skilled labor. They may not have enough equipment to manage this condition. So it's not uniform. For example, I work at the Kenyatta National Hospital, whereby we at least have skilled staff. We at least have all the facilities to manage such an emergency. So it's not the same in the whole of Kenya.
Right.
Yeah.
Just pointing out particular areas, will you say in rural areas they would lack such kind of access to such kind of innovations and access to such kind of healthcare? Yes.
In rural areas, first of all, accessing healthcare is a problem. Accessing skilled labor is a problem. There's also a staff shortage in rural areas, and facilities are not adequate to manage postpartum hemorrhage in rural areas because of such.
Right. And I'd actually speak of Marta's research. Let's get into the numbers here, but not too largely on the numbers. But then there is a report by the NSDCC, National Syndemic and Diseases Control Council, that says Meru County leads in teenage pregnancies. First of all, why is the case? Why is it that Meru is leading there, and what kind of factors make Meru to be leading in such cases?
So I'd say some counties like Meru, So teenage pregnancies come as a result of multiple factors. Number one is education, lack of awareness, lack of sexual education, and also certain cultures. Certain cultures advocate for early marriages. Issues like that. So lack of awareness about sexual education, health matters, and teenage pregnancies are actually on the rise because most women at that age are not willing to access healthcare because of fear of being judged. So lack of accessibility to non-judgmental healthcare is also a problem.
I mean, for where you sit, will you say the fear is rightfully so? I mean, we always hear some of the stories, Daktari. Unasikia mtu anakuambia hapana, mimi sizienda hosi because nasa hapo in a public hospital ataanza kuniambia, give me all kinds of names and all that. Is it rightfully so? Where are we going wrong on this? Is it that now for the health practitioners they're not? Is it the training that the training between the relationship between the nurse or the healthcare giver and also the teenage mom who's coming? Maybe ni hawafunzwi venye wanafaa kuongelesha ama ni wapi hatuendi right?
So that's why we're here as COGS to advocate for more training of staff, to advocate for more hiring of human resource, skilled labor, and to enable us to provide these non-judgmental services, especially in the rural areas where we lack staff, we lack resources. So that's why we're coming in as COGS to advocate for this.
All right.
Yes.
And the fact that you actually mentioned COGS and also the fact that you work under KNH, what are the numbers that you probably have just to form the basis of what we're discussing? So
I'd say in terms, as far as teenage pregnancies are concerned, in Kenya, they're about 15 to 20%. Yes. Okay.
Is that worrying from where you sit?
Yes, it's very worrying because we need to ask ourselves why we have, in the first place, why do we have teenage pregnancies? Is it because we as, for example, parents do not communicate to our children? We do not discuss matters sex education. We do not create this awareness early in life. Is it lack of education, health education, and also lack of awareness?
Right.
Yes.
And yet these adolescent mothers are likely to and are prone to to get PPH.
Yes.
So I mean, most of them they don't understand the whole effect of actually them, the need for them to go to these hospitals and get this prenatal care that they really have. And I also understand that for young mothers, they're likely to be anemic. Yes. Explain to us how this is.
So imagine you're a teenager, you've just found out that you're pregnant. First of all, will you tell anyone? Will you expose this to anyone because of that fear? So you'll be afraid of attending antenatal care. So that's number one. Mm-hmm. So when you don't attend antenatal care, you don't know what pregnancy is about. You don't know why we need to have a safe delivery. You don't know much about pregnancy. So you will not get that exposure. So issues about taking prenatal vitamins and things like that, you don't know anything about that. And you don't know anything about safe motherhood and delivery. So that's because of fear of accessing this healthcare, because you don't want people to know that you're pregnant. Mm-hmm. Another issue is with teenagers, diet is also a problem. Teenagers don't eat well. Most of them tend to eat, junk food and things like that. So you're not having...
It's Monday to Monday.
Yes. You're not having enough iron stores in your body. So that leads to you having anemia. So the little blood you lose at delivery predisposes you to bleeding even more and also worsening your condition. Mm-hmm. Yeah.
And, a question arises here. Where does this all blood come from?
So it could come from the uterus itself. Normally what happens during delivery, psychological response to your body is after delivery you tend to bleed. So what your uterus does in response is, or let's say your body does in response, it releases certain hormones that cause your uterus to harden. So when it hardens, the bleeding reduces.
Right.
Yeah. So if that doesn't happen, your uterus ends up being like more relaxed, not hard, but more relaxed, and that leads to bleeding. So bleeding can come from the uterus. That's number one. It could also come as a result of, tear. You know, you're delivering a 3 kg baby, for example, and that can also stretch your tissue and lead to tear. It can lead to tear like on the cervix, which is part of the uterus, or it can lead to like tear on the vagina, which commonly happens.
Right.
Yes.
When we started, you were talking about some culture norms that might lead to teenage pregnancies.
Yeah.
And there is one culture norm, female genital mutilation. What's its correlation when it comes to now PPH? Does it now alter? Does it affect and increase the rate that someone can have PPH?
Yeah, so female genital mutilation in layman terms is like female circumcision. So you're altering the tissues in your usual anatomy as a woman. So that does predispose to postpartum hemorrhage because for you to have a normal delivery, the passage must be clear. The passage from the uterus, the passage through the cervix, and the passage out of the vagina must be clear. But in female genital mutilation, because of that female circumcision, there's scarring on the outlet. So that predisposes the woman to having tears, because there's scarring. And when you have a tear, what happens? You bleed.
Oh, yes.
Yes.
And the fact that we're actually talking about teenage pregnancies, and I'm actually being reminded now, even for our dear viewer, you can always be the call in. The number is on your screens just below there. You can after credit call in and ask Dr. any kind of question that you have relating to this particular subject, and probably have your own comment. Dr. as we talk about teenage pregnancies, we term a teen probably maybe at 19, but basically someone who's even below the age of 18. Is there a right time to be pregnant, according to you?
Well, that's an interesting question. There's actually no right time.
There's no right time?
There's no right time. Well, of course, we'd say for teenage pregnancies, that's not safe. But once your body has matured, after, of course, during your teenage years, your body is not mature enough to sustain pregnancy. So we'd say that's not the right time. But once your body has matured enough, so let's say when you're...
That's at about what age?
Let's say when you're above 20, when you're out of the teen duration. Okay. So let's say when you're above 20. So your body is matured enough to hold a pregnancy successfully and deliver normally. But you see, in this day and age, we have career women. We have career women who, their careers are, they cannot accommodate you having, multiple, pregnancies or childbirth. Oh, yeah. So some people tend to delay pregnancy because of career. Other women, it's because they've not found the right person. And, you don't want to, have a child maybe with someone you're not sure about, for example. Hujapata mtu wako. So you end up having, delaying that because of that. So those are factors that come into play. So I'd not say there's the right age for pregnancy. But as far as safety is concerned, advanced maternal age, so let's say above 35 years, and I'm not attacking anyone.
Okay.
Above 35 years is a risk factor for, complicated pregnancies. Right. And also very early. So extremes of age, very early, like we're discussing teenage pregnancies, and very late. So those are risk factors for having, complications like postpartum hemorrhage. Okay. So it's neither here nor there. Like there's no right. I can't tell you like 25 is the right age, or 26 or 27. But just the whole point is at a very old and very young are risk factors for certain complications in pregnancy.
Just to be safe by around 20 or 20 and above. Around in March this year, there was the global postpartum hemorrhage summit. And I mean, for this particular summit, World Health Organization and different health stakeholders are discussing what can actually be done to reduce maternal deaths. And it was really stressed that by 2030, they should actually be reducing, some of these deaths. I don't know if you probably maybe have some of this, data for the same, but do you think that can be achieved, reducing, maternal deaths by 2030?
So currently, that's actually SDG number 3. Currently, our maternal mortality rate is at 365 per 100,000 live births at the moment. Now, SDG number 3 aims at reducing maternal mortality rates to about 70 per 100,000 live births by 2030. Now, that's why we're here as COGS. We need to get there, and that's why we're advocating for these issues. So as we were discussing earlier, resources, human skilled labor, equipment, training of healthcare workers. So we still have those gaps in those areas that need to be addressed. Yes.
Right. And actually, speaking of numbers, we do have some numbers even for viewers to also take a look as we continue with this particular discussion. Where, according to WHO, every year an estimated 21 million girls aged 15 to 19 years in developing regions become pregnant, and approximately 12 million of them give birth. And Dr. Even as we continue taking a look at these deaths, according to WHO, how it actually puts it, those in rural areas really are at a high risk, even for the teenage pregnancies and even leading to postpartum hemorrhage. Taking a look at those who in rural areas, are they for them, they don't really have access to some of this healthcare. What are the other factors that some of these girls in rural areas really get?
So number 1 is culture. So some cultures advocate for early marriage, unfortunately. Number 2 is poverty, lack of maybe finances to go to school, because when you go to school, when you're educated, you're more aware and you're actively in school. So you don't have, there's no opportunity to have teenage pregnancies because you're in school, you're going to school, your life is active at that point. Lack of knowledge, lack of resources, lack of accessibility to to skilled labor. Yeah.
All right. And even as we continue, there's a comment here. Someone, the earlier feature, someone asks, so how does it really work, that particular innovation? You're watching this, briefly just explaining to us how does that particular innovation in Malindi Sub-County Hospital, so how does it work, and what's the necessity of it really?
So it just measures your blood loss. Yeah, it gives you a correct estimation of your blood loss. Like we were talking about postpartum hemorrhage, the amount of blood loss. So if you've had a vaginal delivery and you're bleeding more than 500 mLs, and if you've had a cesarean section and you're bleeding more than a liter, so it gives you the estimation of blood loss. And for you to manage postpartum hemorrhage very well, you need to estimate this early. You need to catch it early, because as time is moving, as the mother is bleeding, time is moving, she's bleeding more. So you see that makes it, the situation worse. You can lose the mother in, minutes because of that blood loss. So you need, as a healthcare practitioner, you need to be able to estimate this blood loss as fast as possible.
Right.
Yeah, so that's its importance.
Okay, hopefully they're answered. Now, walk us through, fine, this particular blood has been measured, and so now what next? What steps are taken after, the whole PPH is measured and all that? What steps are taken after?
So as a healthcare practitioner, once you've identified, this looks like this mother is bleeding, so you work as a team. That's why I'm emphasizing the importance of training more workers, because we need you need to work as a team. You need to work as a team of the midwife, including the midwife, the doctor, the medical officer, the gynecologist. All of you need to be present, the anesthetist, and you need all those resources like theater, you need blood, you need, such facilities. So once you identify this postpartum hemorrhage, you identify the cause, you need to give certain medications like what was mentioned earlier. Certain medications like I was talking about, when the uterus is bleeding a lot, it relaxes. So you need medications to harden it. And when you give those medications to harden it, the bleeding reduces. So number one is medication. That's why we need to advocate for availability of quality medications.
Right.
In our hospitals. Now, when you give the medication and still it's not working, you're giving your fluids, you're giving the blood, and still this lady is bleeding, you need to examine and see where this bleeding is coming from. Is it only the uterus, or as we were discussing earlier, it's coming from maybe a tear? Could it be a tear from the cervix or a tear from the vagina? And if you identify the tear, you repair it as soon as possible.
Right.
Yeah. And still, if you've done all those things and it's not working out, well, the third option would be to take her to theater. Yeah, and that's why skilled labor is important. You need to have healthcare workers who can manage this well, okay? So you go to theater, you try all the maneuvers to help the uterus harden, and still that's not working. In the last resort, you've tried everything and the mother's life is at risk and she's bleeding a lot. The last thing is to remove the uterus, because that's the source of the bleeding.
Okay.
Yeah, so that's after you've tried everything. So that's why we need all these resources, to make this work.
Does now diet come into play in all this? Because I mean, now they definitely ask which kind of foods should I be taking to reduce the bleeding, maybe even after, during that process of healing, reducing the bleeding, that kind of, how should my diet, how should my plate be looking like?
So you need to have a balanced diet, and that starts with antenatal care. So we need to emphasize the importance of antenatal care, because that's where now we counsel you on the diet and what you need to take for your supplements. So the supplements have iron, and iron is the most important, nutrient in pregnancy, because remember, it's you and there's someone else in you. So you're two people. So your body is already working overdrive, to provide nutrients for you and the baby. So already you're at like a deficient state, or like a negative balance of your iron. So you need more iron in your diet, which is through now food. So eat foods rich in iron. So green vegetables, things like liver and things like that. In addition to food, you need to also be on the supplements, the antenatal supplements, which contain iron. So that's an addition to that. So yeah, we need to emphasize the importance of attending antenatal care, and watching programs like this where we're